Welcome to the Health System CIO Show. I'm your host, founder, and editor, Anthony Guerra. On today's episode, I'll be speaking with Greg Sieg, CISO at the University of Michigan Regional Health Network. Greg, thanks for joining me today.
Anthony, thanks for having me back. Always good to chat with you and enjoy our time. So looking forward to talking about our topics today and getting going.
Very good, very good. Thank you, Greg. All right, you want to start off by telling us a little bit about your organization and your role?
Yeah, organization, I'm part of Michigan Medicine, and I support our regional health network, which includes two community-based hospitals, one in Lansing, one system, and another in Grand Rapids. And my role is to oversee the information assurance for those organizations as we continue to bring our organizations together and centralize our security posture, if you will.
All right, very good. Well, we're going to talk about resilience, tabletops, all this kind of stuff today, which is absolutely growing as a topic of people are focusing on. So it's kind of fascinating for me to watch that over the last 5 years or so really grow in prominence. Do you see that as well as sort of a trend over the last, 3, 4, 5 years that resilience as opposed to, I mean, everyone's still going to focus on prevention and detection and all that, but just the elevation of the resilience conversation has been dramatic, in my opinion. What are your thoughts?
Yeah, I have to agree. I think, and I don't know, I was thinking about this a little bit this morning. I don't know if it's just that as you get older, you get a little bit wiser. But I think you come in, you're gun ho, you're gonna stop everything. You're not gonna let anything past you. And I think the organizations are realizing with the rise of ransomware and other items that that prevention is one piece, but it's not the whole piece. In the past, it was all about prevent. Don't let anybody in, put a big wall around you, if you will. But ransomware. The way it's come in, it's now gone into, how do we continue business continuity if this happens? And you'll hear a lot of folks talk about, not so much the if, but the when, more or less. CISA, FBI, you'll hear a lot of those talks. It's all about the when, now. And, I think too, the 5 years ago as well, folks that would say have a ransomware attack when they first started coming out, almost were kind of listed as they didn't do a good job, more or less. But the reality is these threat actors are very well informed, of what they're going for. They're very determined. And there's a lot of gaps and a lot of systems that you can look for to get through. And a lot of it comes down to that human factor, phishing events and social engineering. And they're really good at it, just like we're really good at our jobs. So a lot of it comes down to, how do we have that resiliency, when that happens? How do we make sure that business operations continue? How do we make sure that doesn't make it to the next layer? So think of the Swiss cheese model of, okay, they get past layer one, they've got a phishing event, but, now I got MFA to protect layer two. Well, now they get past MFA, how do I protect the next layer down? And that's really a lot about what resiliency is about, is making sure that we have those continuous layers and that we can, make the event much smaller, or at least make it easier to recover from, more or less.
Right. So maybe this is just terminologies here, but what you just described, I always think of as the term defense in depth, having multiple layers. Resilience, I think of more as operational resilience, meaning it's a relationship that is developed between IT/IT security, emergency management, and operations. It's almost an informing, an educating of operations about what outages can look like, different scenarios, and then it's sort of like saying, hey, we can't tell you how to operate without your systems, but we need you to know that you probably are going to have to at some point, right? And so you need to go figure out how to practice medicine. Like, we can't do that for you, but we're going to shepherd you through understanding what these scenarios can look like.
Absolutely, and to your point, the resiliency is less about the technology and much more about the leadership, that comes around with it. But you're absolutely right. I would agree with that. The when I'm looking at resiliency, I'm also looking at not just going and talking with my teams. To your point, but it's talking with the business, talking with the nursing leadership, talking with the nurses as well. I mean, and I'm saying this from obviously from the healthcare standpoint, but when I go out and talk about resiliency, I'm not just going and talking to the CNIO or the CMO or whatnot. I'm going out on the floors and having conversations directly at that level, so that I can understand what their workflows are and better help empower their leadership on how we can get around different issues that they run into. So it's very easy to even in tabletops, very easy to lose sight of what's happening in different layers and different areas of the organization. So involving everybody in there, so you're getting those different perspectives, makes a really big difference there, rather than just going out and starting at the top or one-sided, if you will.
How this is sort of one of the core issues I've been interested in for a long time. It's what is the responsibility as cybersecurity to ensure operational resilience? How far do you have to take that ball? How much do you have to lead in that area? It's almost to me, I think of it as like those races where you pass the baton, relay races where you pass the baton. Like at some point, you pass the baton to operations. You're not going to make sure there's printer paper. You're not going to make sure their forms are updated. You're not going to make sure that they've done sort of the clinical side of practicing without, but you do have to help them. So there's work that you have to do. There's leadership you have to show, but you can't finish the job. So I'm always interested in that dynamic.
Yeah. And there's different perspectives on this one. You mentioned pass the baton. I look at this as a team sport. I look at this as I can't do the nurse's job. The nurses can't do my job, and vice versa. But together we can look out for the patient. And at the end of the day, it's the patient care that really matters. So to your point, I can't fill the paper, but I can bring up that, I can bring up my perspective that we can't just go to paper and that's the solution. And, what I've seen through the organizations, what I've learned. So, I can also bring up that, do you have enough paper in your warehouse, to fill the paper? That's come up on several calls I've run into, as well as folks go, oh, we're going to switch to paper. And then they realize that post COVID, they don't store enough paper on site to handle 2 to 3 days of paper. So I think at the end of the day, when I'm looking at the resilience, it's getting that team together. It's having these conversations that, and really pushing the envelope of, yes, and, going the next step. What happens when we run out of paper? Can we go to Costco to get it? Can we go, whatever? Those conversations, I think, have to kind of work in almost like a group think
Mm-hmm.
environment, if you will,
Mm-hmm.
because that is where you'll start thinking of those different scenarios, and you get those different perspectives from everybody coming in. Otherwise, I think if you lead it out of, say, IT, or you lead it out of, say, emergency management, and I think that's at times where I see the disconnect is emergency management. Excellent ways of how to keep a building, in functioning. And, hospitals are really great at resiliency in general. They're built on protocols that have failure mechanisms in them. So why not learn from that within cyber is the way I look at it. So I like to work very closely with our emergency management teams, but also knowing that emergency management teams do not have the IT background. They don't have the understanding of what's truly going to happen and what's the capabilities. And those capabilities that were there 10 years ago, 5 years ago, and now are vastly different as well. 10 years ago, coming into the industry, It it was a very simple downtime. You go to paper. 5 years ago, it was, we're still going to go to paper. Nowadays, not only do we not have the paper, but we don't have staff that understands how to chart on paper. And that's something just recently in one of my rounding, we do like mini rounding tabletop exercises. I was on a unit and someone said, "Hey, we'll just go to paper," the charge nurse. And every nurse that came walking through the next 20 minutes said, "Well, I've never charted on paper. What do I do? What's the protocol?" And we don't have protocols or policies, procedures around any of that anymore either. It's all around what we're using for the technology backups.
Yeah, so you touched on something that's very interesting, where you were sort of offering thoughts around paper and paper inventories and things like that. It's interesting because it's not your lane per se, and nobody would get angry with you for not talking about paper. But this is where I think it's important, and I'm just thinking out loud. You tell me what you think. It's important if you have a leadership position. You can't be so fixed in your lane. You have to bleed across to other lanes. That's part of the job. That's not a problem. That's part of what you're supposed to be doing. You go a little bit into this lane, they come in a little bit. Everyone, like you said, a group think, brainstorming discussion, because if you have the organizational health in mind, the patient care, then you do those kind of things and you weigh in with those thoughts. If you're laser focused or confined in your box, you don't say those things. But I don't think that that's optimal. I think it's important for everyone to bleed a little bit into each other's lanes in these conversations.
Yeah, at the end of the day, like I said, we've got one goal, and that is how do we keep patient care going? And I can tell you, point blank, I'm not the one to go and do direct patient care. I'm not. I don't like needles. I wouldn't function really well, So, but my place is how can I help the nurses, the doctors, all the other aides? How can I help them be functional at what they do best? What they do best is not checking email. It's not looking at phishing messages. That's not their area of expertise. So how do I make it easier for them? Because there's a requirement of email and other technologies for them to do their job, but that's not their goal when they come in. During the day, their goal is to go and provide the best patient care they can for that person that's in there, for the family members that are out there. That is what their focus is on. So how do I make it super easy for them to do that and not worry about the technology stuff? And sometimes that does mean I have to bleed over a little bit to better understand what they're doing, better get perspectives, and learn, from that.
Yeah, so a couple things there. One is the importance of understanding operations, clinical operations, as much as possible. Um, you mentioned you don't like needles. We don't like needles. I don't like hospital. My wife's a nurse practitioner. I don't like hospitals at all. I can't imagine a line of work where I would go into a hospital every day. But
Yeah.
that's the industry that I cover, although I don't have to go into hospitals. Um, but anyway, the point being, to do your work and to do my work, you need to understand as much as possible about clinical operations and the dynamics and how it works. Uh, so you don't suggest things that make no sense, practically speaking, right? Hey, why don't you
Yeah.
do this? They're like, well, that would never work. So you need to understand a lot about clinical operations. I'd like your thoughts there on IT security folks. If they want to be successful, they need to understand operations. How do you do that?
Yeah, and I'll backtrack a little bit. I think there's value in learning some of those things. Don't get me wrong, but there's also value in making sure you're bringing the right people to the table. So I don't need to be an expert in everything that the nurses do by any means, but yeah, I do need to have somewhat of understanding what their operational flow is, so that I'm putting things in that are assisting them. I think if you look at security, at the end of the day. The more secure you are, the more hindrance you're more likely going to be to operational flow, more or less.
Hmm.
So there's a balance in security, and healthcare is one of those areas that I think is unique in that. If you look at finance, you're not going to say, well, we'll take MFA off because, it'll make it easier, to do this
Right.
process flow, to move this $1 million across. But when you've got, a surgical area, yeah, it may not make sense to have MFA on a PC that's locked in a surgical room and you have other controls in place. So it's an industry that's a little different, that we don't just look at the security controls. We have to look at the whole scope of what we're doing to understand what's best to keep us secure, absolutely, but also make sure that we're doing what's right for the patient at the end of the day. Because if I have a multi-million-dollar special tool that can do life-saving things, but I don't give any access to it to anybody, what good is it? So
Hmm.
it's just it's a weird industry from that perspective to me. It has a little bit differences from other areas, but I think that's, to me, why I like working in it, because there are different obstacles every day that you're looking at, and you're not just going and saying, I got to do everything, to the hilt on security. You're going there saying, how do I make this function and keep it protected? Which adds other challenges and pieces to it.
Yeah, to your point, I've occasionally heard people in security, cybersecurity from other industries come into healthcare, and it's a little bit amusing to hear them with that, absorb that learning curve of, oh, well, I can't do all these things that I used to do. I it used to be very militant. It
Yeah.
was, here's what's done. And as you said, in finance, it's just the way it is. But you come into healthcare and you make the wrong physicians angry, and you're not going to be around very long. As
Yeah, I mean, in manufacturing, if you lock something down too hard, yes, you're going to have there's a cost factor there, but at the end of the day, there's a cost factor, and you figure out how to move forward with it. In in healthcare, if I lock something down too hard, there could be a patient care concern there. There could be something that a machine that didn't get the right readings to a doctor or a nurse, and so the stakes are very different from that perspective.
Yep. Let's talk a little bit about scenario planning. You talked about working with the clinicians and ways to constructively work with them around resilience and things like that. Tabletops, everything is built around scenarios. Everything around insurance and resilience and planning is built around scenarios. You don't just plan for whatever. You plan for certain scenarios. You can plan for one scenario. You can have three different scenarios. You could have 50. Um, these scenarios can be realistic or they can be completely unrealistic. It could be something like the dinosaurs getting hit by a meteor. Something that's going to happen once every three. You're not going to plan for that. It makes no
Yep.
sense. So, what are your thoughts around how you, as an organization, develop the scenarios that you're going to plan to be resilient against?
Yeah. So I mean, to your dinosaur part, I, you know, I think sometimes you have to put those scenarios in there. You have to think outside the box a little bit. Don't get me wrong. I mean, obviously, we try to plan to, what we think is going to be the biggest risk, of the organization. And over the last several years, phishing, social engineering, email compromises, those have been, kind of top of mind. Ransomware, obviously. But every once in a while, you do have to put in those other scenarios because that's what makes you think outside the box and go,
Mm.
"Hey, have we thought everything through?" So when we're doing these, I like to do multiple different ways with them. We've been doing a lot of mini sessions where we'll go just to a single unit and run the scenarios right there live with them. As we're doing things, we don't shut anything down. We don't break anything, but we walk in. We say, "Hey, everything's down. Let's talk through this event." You've got obviously doing tabletops where you bring leadership or team members in to sometimes to an offsite to go through a scenario, walk through how it would be handled, where do they go with playbooks, etc. And then you've got full blown scenarios where you potentially go in and maybe you bring a network down in an area to do actual more testing and bring people in more of a live scenario, if you will. But I think when it's kind of the same thing of what I was saying, groupthink is I don't ever like to go into these and say, well, I'm the cyber leader or emergency management's the leader of emergency management. So we'll figure out the scenario, move on. I think a lot of times we work together to figure out what scenarios we want to run, and we try to keep them fairly realistic typically. Every once in a while, we'll throw some things in there. One thing I like to do as well is keep them realistic, but then throw pieces in there and say, well, it doesn't matter what your answer is. This is what happens next. You might have the right answer, you might have fixed it, but it's going to get worse, and we're going to take you down a couple curveballs before we end the scenario, basically. So that's the way I do like to do it as well. But again, it's that muscle memory. At the end of the day, these scenarios are not built on did our technology do what it was supposed to detect. These are built on what is a person going to do when the call comes in, and how are they going to react? Do they know who to call? Do they have the right documentation built out? I like doing these also kind of across where a lot of times you have leaders that are set for these positions. So if you think of in healthcare, you've got HICS training, which is the emergency management side. There's set people and roles for these. There's also set people that are backups and so on for these. I like to make sure that we're spreading that around as well. We're not bringing the same people in for the scenarios. We're bringing backups in. We're bringing backups of backups in because these events don't happen on Tuesday at 10 a.m. Whenever it's slow. They happen on holiday weekends or at night. They happen when the normal staff's not there, and that's by design. The folks that are making these attacks, they're good. They know the tactics. They time these to be at a time that they're going to be disruptive and more confusing to the staff, because that gives them a leg up. And they're going for every advantage they can.
Very good. Yeah, just a little bit more as thinking through the scenarios, right? So, you can have your EMR, like you could have just your EMR down, which is a big problem. You could have different applications down that are not your EMR, could be niche point applications, whatnot, but they could be important. You could have your network down, so you have no Wi-Fi. And then you could even plan for no cellular, which is a much, much bigger catastrophic kind of regional event, which if I remember correctly, that happened. I was in New York on 9/11, and there was no cellular because all the backups and whatever, and they thought there was redundancy and there wasn't. So that's another scenario. You could literally have no cellular, which is, again, that's more catastrophic, regional catastrophic. And then you could have something like you could have modalities, imaging modalities that aren't working, right? So you could either have the modalities working and the network not working, or you could have the network working and the modalities not working. If the modality is working and the network's not working, you could still do the imaging, but they have to go to the machine, right? Just
Yeah.
from what I understand, to get the reading. So you could still do the imaging, but if the modality is not working now, and you talk about what it takes to deliver patient care. Imaging is one of the core functionalities for a physician to evaluate a patient, along with blood work, and pharmacy, right? There's just some big things. So, just any thoughts with all of that?
Yeah. We've had a lot of those scenarios over the years that haven't even been cyber attacks that have brought down similar areas. Several years ago, we had multiple systems across the United States, right, or across the world that brought the PCs down more or less for
Yeah.
organizations, and so those are all areas that we learn from. And we go, okay, how can we be resilient from that? So to your point on the cell phones and the communication network, this day and age, most of organizations say, well, if my phones are going to go down, I'll go to my cell phone. But if you have a widespread event in your area, say a tornado, something like that coming through, there's a good chance that there's power interruptions or cell towers in your area that are damaged by that, if you will. So typically, other options that you have is going to radios, 900 megahertz emergency radios plus internal radios. And a lot of hospitals have both systems, so they've got a way to get out to emergency services, more long range, and then a way to work internally with those systems as well. You've always had the runners as a possibility. That's becoming less and less with the staffing changes that we've made over the years, where more care workers are more functional. So it's harder to go and say, we'll take this group and turn them into runners. But you do always have other departments that you can bring in, and that's where when these events happen, all your departments become part of that event. Your doesn't matter if it's patient care, your billing departments, your finance departments, that everyone comes in and joins. Basically, and helps out with whatever options that they can at the time. But to your point in the scenarios, I think that's I don't want to say the fun thing, but that's the interesting thing here is. There's always, you go through all these scenarios and then something always happens. You go, oh, we didn't think of that one.
Right.
And that's where thinking outside the box comes in a little bit. You're never going to get every scenario right. But once you get into the scenarios, they typically run the same playbook at the end of the day. So it's making sure that your staff is prepared for what are your steps and what are the people that are in the organization that are going to make the decisions, and how are they going to get into that. So if communications are down, and let's say your radios are down because they're doing a maintenance update on them, you're going to have a central location that you're going to get your leadership in to start having those conversations face to face. And then you're going to start looking at, okay, what options do we have to start getting widespread communications up? That's going to be a priority, obviously. So I think, when you look at those and when you do these tabletops, that's where you throw these curveballs in. You run a tabletop and you start throwing these curveballs in to get people to start thinking, okay, what else could we do to back this up? Obviously, you can't back up for every scenario. There's economically, it's just not even possible, either. But you start thinking of these and you think of what options you have on the table, at the end of the day. And I like to think too, to your point, is not just thinking of a system down, like us down, but if you go back to the scenario I talked about a couple years ago with the PCs, that affected multiple hospitals in our regional area. So typically a hospital, when they're in one of these events, they'll go on what's called diversion, and they'll go and they'll say, hey, we're not accepting patients in, or we're not accepting maybe trauma or ER. They need to go to the other hospital. So they send the ambulances to the other hospitals. But when you have a wide scale event, you don't have that ability, and you need to be communicating with those other hospitals as well. Right. We haven't really talked about this a ton here, but that's where getting in with a lot of states have the regional healthcare coalitions that can help out with that. There's a lot of other organizations, like in our case, we do a lot of work with the Michigan Hospital Association, the regional healthcare coalitions, and then another organization, the Michigan Healthcare Cybersecurity Council, to bring these events together from a regional stance, not just our hospital. So we're doing tabletops kind of across the board with these as well. That because if I'm down, there's a very good chance that I'm causing outages for other facilities as well, from lab services, potentially imaging services, to other facilities, because of the services we provide and or the overlap of the physician networks, potentially.
Yeah, I mean, you're 100% right. Obviously, it makes a ton of sense. It's a regional play. They're doing something. The HSCC is doing Operation Vital Signs, which is the national tabletop. They're doing that in a couple weeks, I think.
Yep.
So that's interesting. That's a national play. But yeah, I mean, to your point, it makes no sense to do this in a vacuum as one health system. You have to look at this as a regional play, because it's almost comical, not comical, but comical to say, all right, we're going on diversion, and you call up the health system and say, yeah, we're sending everybody your way. And they say, whoa, we're in the same boat you are. Don't send anybody over here, right? So imagine somebody doing that to you, somebody saying, hey, we're sending all our patients over by you when you're having the same problem they are. Which makes me think of communications, right? It's all about communications. You mentioned that that's so important. We need to have a structure in place because we're never going to figure out every scenario. So we need to have a structure in place that's scenario agnostic, right? We could plug in any scenario and we've got enough of a structure, whether it's governance or group, in place that we can feed the scenario in and deal with it. But communication is key. If we don't have sort of prearranged rendezvous place, like, oh, we're all going to come in, we're going to be in this conference room, here are the key people, here's how we communicate if Wi-Fi's down, here's how we communicate if cellular's down. But all these people, if we get all these people in a room, we're going to be able to deal with a lot. So I don't know, what do you think of all that?
Yeah, and I think that's where, as we're talking, I think that's kind of where we've seen this shift to resiliency the last few years. Is I think historically you've looked at these events and they've kind of been pushed to IT. This is an IT system down. How do we fix this?
Right.
And IT is really, really good. Information security is really, really good at their job. They're not historically really good at the business. And like I said, everybody has their place. In our organization. I think as we've seen these events and we've started to include emergency management and the business leaders, that's where we're seeing that shift of okay, where's everybody's position, and IT can, and that's the other thing, is IT is typically working on, potentially the issue of getting it back up and running. That's what their focus is on. Their focus is not on the communications out to the staff or whatnot. So I think as we've come together, that's where a lot of that shift has happened. Is we've brought pieces that have worked really well, from other resiliency and downtime scenarios over the years that were, maybe not just IT related, but
Mm-hmm.
disaster of a power outage, etc. And we've started to build that into our IT resiliency systems. And it's brought in a different play to it. And part of that's with the fact that 15 years ago, IT played a role, but they weren't as much of a vital role as they are today with systems.
I think you just absolutely hit the nail on the head. I think that you just summed it up. It's a shift from an IT problem and applications down, let us know when it's coming back up, to an us. It's an organizational problem. Everyone has to be in the room. And the other thing is, I think there has to be CEO level leadership in that room because this will escalate very, very quickly to CEO level decisions around what do we take down. Okay, and that's on the recommendation of IT saying, hey, this needs to come, IT/IT security. An application needs to come down. We need to take A, B, and C down. The chief medical officer and the chief nursing officer have to hear that and say, okay, that's what this means for us. There are time frames involved. Take it down when? Take it down in 5 minutes, take it down in 2 hours. There's cyber insurance issues. There could be the FBI involved. There could be regional issues. This is very quickly a CEO level issue. So it goes from an IT problem to an organizational problem with IT being a critical component, and the CEO must be in the room. Those are my thoughts.
Yeah, and to even build upon that, one of the things I think a lot of organizations, it's being talked about more now, but a lot of organizations still haven't realized is those decisions almost need to be made before the event happens. And what I mean by that is they need to understand, are you calling the BI in? Are you getting them there? And really those connections should be being made before an event happens. It's much easier to go and give a call to the FBI or in Michigan, the MSP has been great, through working through these, but giving connections out to your legal groups within your area in other groups of making those connections now, because in the moment that something's happening, it's too late to try to figure out who your connections are, to try to build that rapport with them and understand what they need, because you're focused on a lot of other things. Same thing with your insurance partners. If it's not enough just to go purchase cybersecurity insurance, you should be talking with your insurer on scenarios. A lot of times they include tabletops, they include this type of items within their packages that they provide you. And they typically also include groups to work with in the event that you have a breach. It's really good to get ahead to get that list. Do that work ahead of time. Reach out to the groups. Find a group that you want to work with. Hopefully, you never have to work with them, but find that group, have the conversations with them, and keep that dialogue moving so that you're ahead of the curve. If something does happen.
That's great stuff. Just one or two more questions. We talked about it being an organizational issue and needing to be CEO led. Um, do you think that there are some organizations where IT/IT security leaders are having trouble getting the level of engagement they need in different tabletops and exercises? We want everybody at the table. If we identify we need someone at the table, I'm sure it's easier now than it used to be, but what would your advice be to any IT or IT security leader who's having trouble just getting the calendar commitment from some of the key people they want in those discussions?
Yeah, there's definitely organizations I think that still run into that throughout the day, and to your point, it's definitely getting better. I think we're seeing it from multiple sides. So the CEOs are getting it from the boards. The boards are getting the education as well. That's pushing on these issues. My advice to someone if they're running into those issues is to start asking questions on your cyber insurance. Work from that perspective. Work from the areas that you know are going to help you out. Working with your compliance groups, your legal groups, your insurance groups. And if you're not working with your emergency management, get with your emergency management. Start having those conversations. Start bringing those together, and then uniformly start working on getting the CEO involvement. They don't need to be involved at every step by any means, but getting them understanding what's going on, getting them into at least an executive level tabletop yearly to review what's going on, get an understanding of it, and get their buy-in. Is tremendous, support at that point. But I think if you're struggling there, get with those teams that maybe aren't out there that that you're connecting with, and start working with those to bring them in to start building out that package so that you're utilizing your CEO's time to the best of your ability. You're bringing them in and you have everything ready to go.
Yes.
You're not wasting their time, and
Yes.
they're coming out of it feeling really good about the team, feeling good that they can go back to the board and say, hey, we did this, it went really well, and these were the bullet points we've got back from it. If you go in there and you're not prepared, they're not going to want to come back.
You're so right. I mean, that's honestly how I look at life. I think that's like a huge life lesson. Don't waste anybody's time. Be prepared. Um, Final question is, um, someone has to be leading this in a health system. It doesn't have to be the CISO. It doesn't have to be CIO. It doesn't have to be emergency manager. It could be any of those people. But someone has to be sort of moving this along. So if again, thinking out loud and you can respond, if you're a CISO and you see emergency management really leading, no problem. Be supportive, great. You got plenty to do. You don't need to lead it, but you can support and make sure, the CISO viewpoint is getting put in there. If you happen to not see anyone in your organization leading this to the degree that makes you comfortable, so you're like, I just don't feel like we're where we need to be, it's probably a really good idea to try and lead a little bit yourself, not dominate, not bully, but maybe just try and move the ball. Someone's got to own this. We talked about this. I did an interview with John Regi and William Walders from AHA and Joint Commission. And John Regi, who was formerly with the FBI, he talked about someone has to own it. He called it the responsible executive or the accountable executive, but makes total sense. So if no one else is owning it, you might want to think about just taking care of it. Someone has to. Your thoughts?
100%. And you brought up a good point. I was actually just going to bring up the Joint Commission as well. Within this is The regulatory bodies are making it easier for someone to own it. I think they're putting it more on the priority list. Where 10 years ago, cyber IT was a really small part of that survey. They're bringing in they're bringing emergency management in much more, in my opinion, as well, making it much easier for someone to be a part of it. Every organization is different on how they run. I've seen organizations that run this out of the information security and IT shop. I've seen them run out of emergency management. I've seen them run out of compliance in cases, depending on the size and whatnot. So I don't feel that there's a quote unquote right spot for this, but there is definitely a from my perspective, the CISO needs to feel comfortable with it. Emergency management needs to feel comfortable with it. More so than anybody else, in my opinion. Who's leading it doesn't really. I don't really have a push one way or another, as long as somebody is. And if somebody's not, I think it's part of my responsibility to come in and assist and try to build that program up and explain why, and work with all those departments that I mentioned, compliance, and risk, insurance, etc., to make sure that that's the top of our list. That we're getting prioritization from all of the groups, because if IT's trying, I will say, if IT's trying to run this on their own, or emergency management's trying to run this on their own, it will fail, in my opinion, at the end of the day, because you won't get the right perspectives in that room to have the right decisions, or to determine the right curveballs to throw in for the training.
Well, Greg, this was a pleasure. Absolutely perfect. A wonderful conversation. It's been great to catch up with you after a little while, and I hope we can catch up with you again down the road. So thank you
Absolutely,
so
Anthony.
much for your time today.
Thank you very much as well. It's great chatting with you again. Always appreciate it.
Have a great day.
You too.